I'm Neeta Rao, working as Senior Health Lead with United States Agency for International Development, India, for more than 12 years. My leadership project title is Provide Customized Support to Women Entrepreneurs in Healthcare to Access Capital and Market for Sustainable Business. There is enough evidence on limited access to credit by women and the need to invest in women-led businesses. Many studies focused on what are the challenges faced by women entrepreneurs. My leadership project focuses on why women face challenges. As a part of the project, I interviewed women entrepreneurs in the health sector to understand the facilitating factors and challenges and elicited clear asks to design and implement support systems. As I interviewed women entrepreneurs in the healthcare ecosystem, they came from relatively high socioeconomic status households. Against this backdrop, it was interesting to unearth their strengths and challenges. The facilitating factors were positive life experience. Almost all of them had their mother or sister as role model. Most of them had access to pro bono support, including intellectual support, through their social circles and connections. Education and educational environment supported entrepreneurial spirit. Early success in career was motivating and also opened doors for further opportunities and resources. There was a personal story to the business idea and exposure to entrepreneurial ecosystem, including venture capitalists, investors, development partners, and other entrepreneurs served as a huge boost to them. In terms of challenges, whether it was parental or family responsibilities, they were shared by the spouses. However, there was expectation from women by the family and the society to take on more responsibilities, especially during certain phases in life like child rearing and caring for the senior citizens. There was a general apathy from the family. One of the respondents mentioned that while her father provided a lot of guidance and advice to her brother for the business, he did not ever accept the fact that she was also a businesswoman. Women are not perceived for business. It is felt that business is a hobby for women when they have less responsibilities. They are not taken seriously until and unless they prove their worth. They generally felt passionate about the cause and the service, but when it came to accessing resources and expanding business, they felt a lot of stress. There's limited opportunity to network, whether it is academic circles or it is discussion forums. They are generally gendered with negative bias for women. There is no open space where women can freely express themselves. Some respondents also felt that women are naive in understanding organizational politics and dynamics. One of them also mentioned that she was seeking support from people who were working against her. This is largely because women are not accepted as leaders and successful role models. The asks were very clear. Women expressed need for connections and strong relationships that could be tapped, especially to protect their businesses. Legal and regulatory expertise, which are easily available to men, should also be available to them. Technical know-how did exist. However, they felt the need for deeper technical understanding when the business was growing. Social circles of entrepreneurs from other sectors was a huge need. Understanding that businesses are not linear, there are lots of ups and downs, and they need to stay put during challenging times, especially when there is high demand on personal responsibilities. Need for women advisors and mentors who can empathize and are relatable are also important. Now, switching gears to my leadership journey. Talking about my authentic leadership style, the deep-seated inequities in the societal fabric has always troubled me. I see this opportunity of my leadership project to inquire into these towards harnessing the leadership qualities of women, including exploring my own potential. I've been inclusive in understanding the perspectives, not only from the respondents, but from the peers of the cohort, facilitators, mentor, and my coach. In terms of being strategic, I want to lead the change. I propose to integrate this as a part of my current project and lead the change with a very strong intent, taking it from words to action. I'm very happy to share that I have led the development of a gender lens investing toolkit, and I'm hoping to mobilize additional resources for systematic capacity enhancement of women entrepreneurs in health sector. I want my leadership project to have a meaningful contribution to other women's lives and leadership abilities, allowing them access to capital and to market, making them successful. In terms of my overall leadership journey, it has been truly life transformative experience, providing a lot of perspectives on gender, or equipping me with tools and resources, and above all, providing a safe space and lifelong friendships. On the slide, I have shared my leadership impact statement that was developed with support from the peers of my cohort. Thank you for your patience here.